Good morning. Today I'll be critically analysing the literature on the effects of transcranial direct current stimulation on schizophrenia. Schizophrenia is a severe cognitive disorder that affects the domains of cognition and behaviour caused by abnormalities in brain structure and functions. Clinicians are unsure of the neurological bases that contribute to this disorder, but it is hypothesized the prefrontal and temporal cortical neural systems appear to be affected, as well as alterations in cortical, glutamatergic, and GABAergic systems. There is a strong link between genetics and the likelihood of a person developing this disorder. Transcranial direct current stimulation is a relatively new tool in neuropsychiatry that has led to the treatment of a range of disorders including schizophrenia. TDCS is a non-invasive electromagnetic stimulation of the human brain which manipulates the membrane of potential neurons and modulates spontaneous firing rates. TDCS has been a suggested treatment option for patients diagnosed with schizophrenia, specifically in auditory hallucinations. The result of a recent systematic review assessing the use of TDCS for the treatment of auditory hallucinations of schizophrenic patients found a significant reduction in the severity of these hallucinations. A similar study placed the anode over the left dorsolateral prefrontal cortex and the cathode over the left temporal parietal cortex and found that auditory and verbal hallucinations were drastically reduced by TDCS relative to sham stimulation. According to empirical reviews, the benefits included neuroplasticity modulation as well as correction of the corollary discharge deficit system and supported a nodal stimulation to the prefrontal cortex to reduce negative systems. Many studies have suggested that TDCS is an effective option for the treatment of schizophrenia, although there is still further research to be done. The main gap in the research of TDCS on schizophrenia is that the sample sizes for their studies have been small and ungeneralizable. TDCS has also been criticized depending on the localization of currents. It is still being determined by clinicians what areas are affected by certain stimulations. Further research with larger sample sizes is a necessity. The future direction of TDCS is considered to be hopeful, as it is becoming a replacement for pharmacotherapy, which is beneficial for those who have previously been addicted to drugs. Clinical trials must be continued in the future to ensure that TDCS is a safe alternative to pharmacotherapy and can be effectively treated patients diagnosed with schizophrenia. TDCS is a treatment option that uses non-invasive electrical stimulation to increase neural activity. TDCS has been found through clinical studies to have a positive effect on reducing auditory hallucinations in patients with schizophrenia, as well as reducing negative symptoms. However, there is still criticism of these studies and room for development before it can be used as a primary tool for the treatment of schizophrenia.